Right, I think we're working.
Good afternoon, everyone. Hopefully you can hear us. Unfortunately, we've had a few technical issues on the laptop, so I've had to improvise and use the phone. But I'm Emily Brace, consultant midwife here at the Oxford University Hospital, and I'm just here with Kate Boys, who is a health practitioner here at Here for Health. So I've invited Kate along today just to talk about carbon monoxide in pregnancy, which isn't just associated to smoking. So I'm going to hand over to Kate, who will give you a bit of a spiel and information around carbon monoxide, things to how we can best support ourselves when we're pregnant, and then also if you can put any questions in, we'll come to those then towards the end. So I'm going to be fleeting between the phone and the laptop, so I do apologise once again for the delay.
Fingers crossed, technology-wise, we'll be all right. So let's see how we go. But yeah, if you've got any questions, please do pop them in the comments below, and we will do our best to coordinate those. There's a little bit of a delay between us going live and the comments coming through, so yeah, sorry if we don't see those straight away. So as Emily mentioned, my name is Kate and I work for the Here for Health team. So we are a team within the trust, within Oxford University Hospitals Trust, and we're essentially the health and wellbeing team. So what we do within our team is we help individuals and families to be as healthy and as well as they can be, and whatever that means for them. So for some individuals, that's support around smoking cessation. That might be sort of alcohol reduction. This is outside, of course, of maternity remit. We support people around healthy eating, exercise, a little aspect of emotional well-being as well. So we're a bit of a jack of all trades. And what I wanted to focus on today was carbon monoxide. And we are going to have a look at smoking cessation within that as well. But specifically, I want to talk a bit more broadly to begin with about carbon monoxide. So what is carbon monoxide and why are we testing for it in pregnancy? So carbon monoxide is a poisonous gas that when we inhale it, it binds to our red blood cells. So it takes up space on our red blood cells where the oxygen is supposed to be connecting and being delivered around the body. Yeah, so that's what happens when we inhale it. Now, carbon monoxide, unfortunately, we can't see it, we can't taste it, we can't smell it. It's an invisible gas. So it can be really difficult to know what our carbon monoxide level is and also sort of where it's coming from. There are a few symptoms that we can get when the levels go really, really high. But this is one of the key reasons why in pregnancy we test for it, because it can be very harmful if our levels go too high. We normally, when we can do, test for carbon monoxide during pregnancy. Now, one thing to be aware of with carbon monoxide as well is that when it is moved around the body and when it's attached to the red blood cells, it does also cross the placenta as well. So this can mean that both mum and baby have a lower oxygen level than they would normally. And so this is why it's really important that we check for carbon monoxide, that we know what the signs are if it's going to be too high, and the things that we can do to reduce it. So there's 3 points, and correct me if I'm wrong, Emily, because I'm a little bit out of touch with the world of maternity with this. 3 points when we test for it in pregnancy. So let me check this. So the first one is at the booking appointment.
Yes.
Yeah. Are they still doing it at the 20-week scan?
So it should be we want to test it at least on 2 occasions during the pregnancy. So at booking and ideally around 36 weeks, but what we always train midwives is around making every contact count. So if a mum is smoking or she's had a high reading, we wouldn't then obviously take it at booking and then leave it till 36 weeks. It's about having that conversation again at the next contact. Some women find it really useful that when they're using the carbon monoxide screening, you know, that helps them. It's a motivator, particularly if they are looking to stop smoking or reduce their smoking intake. You know, they will often use the CO screening and want, you know, and prompt the midwife to, you know, have the screening at the contact, because it is a motivator. Does help for that behavioural change as well. So at least 2 occasions during the pregnancy, but During the COVID times, we have had to temporarily pause the CO screening, but that hasn't stopped the conversations. The conversations should absolutely still be had around behavioural change.
Yeah. So as Emily mentioned, at the moment, we're not screening for carbon monoxide in pregnancy, but nonetheless, it is important to be aware of what those signs and symptoms are. And there's still, even though we're not testing for it, it's still really, really important to try and get that carbon monoxide down as low as you possibly can throughout pregnancy. So that's when we normally test for it. Now, how does the test work? So if you get to a point in your pregnancy where we do start testing again, we thought it might be useful just to show you the machine, show you what it kind of looks like, so that when you get to that test, you'll know exactly what you're doing, you'll be ahead of the game. So you're going to see a little machine a little bit like this, and essentially what the midwife is going to do, she's going to switch it on, and the little picture is going to appear on here, and she's going to have a little straw that she's going to get you to blow into as well. We'll see when this happens, if it's going to be this year or not. And essentially what you need to do is a little bit like a breathalyzer. So you're taking a deep breath, you're going to hold your breath for about 15 seconds, and then at the end of the 15 seconds you blow out as long and as hard as you can. And that's going to give you a reading of your carbon monoxide level in your blood. And what we do is we'll then check that and see where that puts you. So I'm going to just show you on here. I'm hoping you can see that on there. The side that we're going to be interested in for pregnant women is up along this side. So what this shows us is that the ideal range, or the low risk range in relation to the amount of carbon monoxide that's in your blood, is going to be up to 3 on what we call ppm, parts per million. Any higher than that, it's going to start putting you into those risk categories. So you've got your kind of amber risk and then your high risk up to here. Now outside of pregnancy it can go a little bit higher, but our goal really is to keep it lower than 3. The reason it's not 0 is because there's some carbon monoxide in the atmosphere. It just exists. And so it's very, very rare that you'll get somebody that has a reading of 0 or 1. But that's what we're working towards, to get it down as low as possible. So the key thing to be aware of is that the main cause of having a high CO, as we call it, carbon monoxide reading, is smoking. And so the best thing that you can possibly do if you want your carbon monoxide reading to come down, so that you're not getting any sort of side effects or the harm that is caused by carbon monoxide, is to quit smoking as quickly as you possibly can. But there are a few other causes of high carbon monoxide readings that can be really important to be aware of if you are not a smoker. So I'm just going to run through these. I've got my notes, so I'm just going to keep looking up and down with this. So the first one, if you're not a smoker, is any secondhand smoke. So if you live with anybody else that's a smoker, even if they're smoking outside the house, a lot of those particles do still stick to clothing and they're in their breath. And so unfortunately you can have a slightly high carbon monoxide reading from living with another smoker. The other one is a faulty car exhaust. That can cause your carbon monoxide to go up. If you live in an area of high air pollution, so if you're in an area that's got a lot of traffic outside your door, your reading might be a little bit higher than normal. Faulty home appliances, so that can include anything that's got gas. So that's your gas boiler, that's if you've got a wood burning stove. They're becoming really trendy at the moment. I don't know if around where you're living as well, everybody's got a wood burning stove. So it's really important to make sure that they are properly fitted and that they're properly maintained as well. What a lot of people tend to do is they'll get a carbon monoxide alarm. So you can get them for about £10 on Amazon or so. They're not very expensive, and they're really, really useful to have in your home, just to make sure that you're not putting yourself or your family at risk. A gas cooker as well. So those are the key ones. Any appliances in your home that use gas. Frequent exposure to barbecue smoke. So you're not going to get a really, really high reading with this, but essentially carbon monoxide is formed from incomplete combustion. And so with barbecue smoke, it's not complete combustion. And so if you're having a lot of barbecues, just don't stand too close. That's the general rule. Make sure it's in a well ventilated space. Paint stripper as well, that's another one. So alcohol can give you a high reading, and so can lactose intolerance. If you know that you are lactose intolerant, you might also get a high reading with your carbon monoxide when you get that checked. Now, with both of these, they're actually false readings. So even though it will say that you've got a high CO reading, it's not actually that you've got a high carbon monoxide reading. It's that there's something else that's being emitted in your breath that's causing the machine to read high. So that's a good thing. So if you are sort of lactose intolerant, don't worry. What a lot of people do if they are lactose intolerant is just make sure that you don't have any dairy products on the morning of your appointment, just so that we can kind of rule that out as a possibility for why you've got a high CO, and then we can kind of see if it is actually a high carbon monoxide reading. The other thing with from an alcohol perspective is any sort of mouthwash that contains alcohol also can cause it to go a little bit high, as can the alcohol hand gel. So what we tend to recommend people do from that regard is to wash their hands with soap and water, rather than the alcohol hand gel before they use the monitor. And from a midwifery perspective, to not clean the machines too frequently or too close to when you're going to be testing it with the alcohol wipes, because it causes false reading to come up. So in relation to the other things that you can do if you do get a high reading, other than if you're lactose intolerant and the alcohol, of course, if you're a smoker, your best bet, as we've mentioned already, is to stop as soon as you possibly can. We know that you are 3 times more likely to quit successfully with professional support when you do it on your own. So it's always worth giving it a go. And the good news is you really have nothing to lose. There's completely free support across Oxfordshire that I'm going to go into in a minute. But it's, definitely the best thing you can do. Check for and repair any faulty appliances as well. So make sure that all of the gas appliances that I've already mentioned in your home are well maintained. If you're living in rented property, make sure you're in good dialogue with your landlord or landlady to make sure that they're well maintained. If you've got a chimney, check when it was last swept, because that also can cause a little bit of carbon monoxide to be floating around at home. And make sure that they've all been serviced recently. And then your car as well, make sure that your car is passing all of its checks. And if you are finding that you're getting a little bit of a funny smell when you're driving, it is a really good idea to go and speak to a mechanic and get that sorted. The other thing to be aware of are the symptoms of carbon monoxide poisoning. So it's quite rare to get this, and your carbon monoxide level does go it does need to be quite high before you're going to get any symptoms, which is why we talk about the things to look out for. But it's very useful to know what the symptoms are. So if you are suffering with any persistent headaches, any cold or flu-like symptoms that are just persistent and you're not quite sure why they're not going away. Some people describe them like hangover symptoms. If you're kind of feeling a bit hungover, or if you or somebody in your household seems to be getting confused quite a lot recently, those are some of the symptoms to look out for with carbon monoxide poisoning. So if you are getting any of these symptoms, it's really important that you speak to the National Gas Emergency Service line. So actually, Emily, maybe would you mind? Well, what we can do is throughout the questions is maybe pop these numbers on in the comments or something.
I can put that in the comment, no problem.
Thank you. So if you are getting those symptoms, those are the key things to do. Speak to the Gas Emergency Safety line and they can check that for you. Make sure that you're all right.
I will do that straight after. Unfortunately, I can't seem to get onto the comments from this area. 2 secs. Carry on, Kate.
I'm going to carry on. That's right. Okay, so that is carbon monoxide as a very general kind of topic. And now what I want to have a look at is, as I mentioned before, the key reason why your carbon monoxide level is going to be up, and that is smoking. And what the benefits are, of course, of quitting smoking specifically in pregnancy. Why is it a good idea to quit specifically in pregnancy? So quitting smoking in pregnancy is one of, if not the best thing that somebody can do to improve their health and their baby's health during their pregnancy. Out of all of the bits and pieces to do, that's one of the best things. And there can be quite a lot of complications that can come about if you do smoke during your pregnancy. So not only during the pregnancy, but also it increases the risk of complications at your birth and also postnatally as well. But the good news is that the evidence tells us that by quitting smoking quite early on in the pregnancy, you can reduce, in fact I want to get this right, stopping smoking early on in the pregnancy can almost entirely stop the increased risk of these complications from occurring, which is amazing. Like, it's not just one or two of them, it's literally all of them. So that's fantastic news. So if you can stop early on in the pregnancy, you're going to reduce the chances of all these complications.
Absolutely, but at any point during the pregnancy, it's an opportune time to stop, because
Absolutely.
obviously those risks continue for as long as the smoking is persisted.
Yeah.
So although absolutely preconceptually ideally, but if not early in the, once you've booked the pregnancy, so that we can really stop those harmful effects passing over the placenta.
Absolutely, yeah. And the good news is that the benefits stack up as time goes by. So as Emily mentioned, no matter what point you're at in your pregnancy, it is never too late to quit. As we've been talking about carbon monoxide, from a carbon monoxide perspective, actually within even just 1 to 2 days, your carbon monoxide starts to pass out of your bloodstream and is replaced with oxygen, and your oxygen levels start to come back up to normal, which is just amazing. And of course, carbon monoxide is one of the most harmful ingredients in cigarettes. So it really is never too late to go for it and to quit smoking. And then the longer you've quit for, the more the benefits stack up, and the more your health improves, and that of your baby as well. So it's really, really key to quit as soon as you can do. So that's really the most important thing. Now, in terms of how do you stop smoking, there's not really one way to do it, but everybody does it a little bit differently. But there are a few key factors to consider if you are thinking about stopping smoking. As I mentioned, if you are keen to quit smoking, it's definitely worth getting some professional help to do that, because as I said, you're 3 times more likely to quit successfully. But the other side of it is to look at both sides of the addiction. So we know with anybody who smokes, there's kind of 2 sides to that addiction. So you've got the pharmacological aspect, which is the nicotine, and then you've got the psychological aspect, which is the behaviour or the habit, right? And we all have good habits and we all have not so good habits, myself included. So it's really useful to be able to look at both sides of this. Now, from a nicotine perspective, the Community Stop Smoking Service, Smoke Free Life Oxfordshire, are able to provide completely free what we call NRT, nicotine replacement therapy, to anybody who is interested in quitting smoking. So it doesn't just have to be pregnant women, it's their partners, it's their family members, it's anybody at all that lives within Oxfordshire can access this free support. And what they would normally recommend is, usually, depending on how much you're smoking and how frequently, a combination of nicotine replacement. So that usually is a nicotine patch, and the idea behind the patches is that they give you a kind of baseline of nicotine throughout the day, a steady dose of nicotine. And then what they'd also give you is a sort of a top-up product. So for those moments in your day when those cravings get really strong, you can have an additional product on top of the patch to help you get through those cravings. Now, a lot of people think that nicotine is harmful. What we do know is actually nicotine in and of itself, relatively speaking, is actually very, very low risk in relation to cigarettes and in relation to smoking. So actually they're negligible, the risks of being on just nicotine. The issue really is that it's often associated with smoking, so that's where we can get a bit of trouble. But nicotine in and of itself is a much, much safer option than smoking. So there's a few different products that you can try. One of them I wanted to show you is something called an inhalator, and I don't know if anybody's seen this before, but essentially this is a little, have you seen this before? The little kind of inhalators, it's like a little white stick. It's about the same size as a cigarette, and what this product does is it gives you a sort of quick hit of some nicotine, and so what you've got is this is the applicator, and you're going to get some little cartridges that you're going to put inside, and you just pop it back together again, twist it to seal it, and then it's good to go. So this is a really, really good option for anybody that's looking for the hand to mouth action, and that's what they're kind of craving. That can be really, really useful in addition to the patches. There's also lozenges, there's sprays, there's gum, there's bits and pieces you can stick up your nose. There's all sorts that are available with Smoke Free Life Oxfordshire. So it's definitely worth checking it out and getting in touch with them. The good news is that within Oxfordshire we're very lucky to have an automatic referral system. So if you do smoke, or you're just beginning your pregnancy and you're about to have your booking appointment, you will be automatically referred to the Stop Smoking team, so that they can have this discussion with you and talk you through the support options that are available. So they're a fantastic team. It's definitely worth getting in touch with them. They're not there to sort of tell you what to do or to they're literally just there to support you and to find the best way to help you to quit smoking. So they're definitely worth getting in touch with. I've got their leaflet, and again what we might do is put their contact details maybe up in the comments.
I'll do that.
So this is Smoke Free Life. These are the guys who work out in the community, and as I said, it's a 12-week program. It's a combination of the nicotine replacement therapy and then the behavioural support as well. From my team perspective, we're the hospital stop smoking service team, I guess, and we work in partnership with Smoke Free Life. And you can get in touch with us as well. We can't do the nicotine replacement within the community. That's with Smoke Free Life, but we're happy to kind of talk through things from a behavioural perspective. We love talking about habits and behaviour change and everything else, so we'd be really happy to talk to you.
And I guess it's just knowing that you're not alone. We acknowledge that it's difficult, and that there is help out there. We wouldn't expect you to do that on your own. As Kate's already said, we already can see that women who are going to make more sustainable change if they are having behavioural support and also the nicotine replacement therapy. So just know that if you are struggling out in the community, or you or your partner, you might not smoke but your partner does, as Kate said, we can still refer your partner into Stop Smoking services to help them. And I guess it's just thinking it's not just about the health benefits for you as a mum, but if you have children already, but also the unborn, your baby. So obviously significant health benefits. The earlier you stop, we would decrease some of those risks being passed over, particularly around smaller birth weights. It can really affect the placenta and how well it's perfusing. So we must just best support you and support your newborn.
And not only that, you're going to save yourself a couple of quid because it's getting really expensive to smoke, so you're going to save money. You're going to, as Emily said, you're going to support the health of those around you. There's also, particularly in recent times, people who smoke have got an increased risk of contracting COVID and also having severe symptoms with COVID. So that's even another benefit that you'll get, is that you'll be reducing the risk of those, which is really good. The other sorts of support that are available, there are a few telephone numbers that you can call, and there's some really fantastic apps. So if you're into apps and sort of digital support, it's in black and white. I'm really sorry, on a bit of a
we can probably get the apps and link them up.
That'd be amazing.
Into the comments.
Thank you. Yeah, so just a few on there. The Smoke Free app, it's a little green heart. You can't see it on here. It's a really, really good one. Then we've got the NHS Smoke Free app as well, and then Quit with Bella, which is from the guys who run the Smoke Free Life Oxfordshire team. So they're really excellent for support options as well. So I think that's mostly me and my bits and
that's
pieces.
Great. Thanks so much, Kate. So between the phone and the laptop, I'm really sorry, but I'm just going to have a little look at the comments that are coming through, because I think this laptop is a little bit behind. So we've got one comment certainly in the comment box on here, and I will check the phone in a minute. But from Roxana. So hi, I quit smoking as soon as I knew I was pregnant. 33 weeks pregnant with twins. Congratulations.
Oh, fantastic.
But recently I've been desiring so badly a cigarette. So is a week now I am smoking 1 cigarette a day. Is this too much for my babies now? So what we say is any effect can be passed over the placenta. There is no, obviously if you're smoking a lot and you've managed to reduce it, you've made already significant gains, but we would never be able to give you that 100% guarantee. There's still those toxins within cigarettes. So what I would suggest to you, Roxana, is don't feel that you're alone. This is a real opportunity now for us to support you with Stop Smoking. I was going to say Stop Smoking Wales then, sorry. Stop Smoking Services here in
Yeah,
Oxfordshire.
Yeah.
And they can certainly put you in touch with the NRT to support you as well as the behavioural support. Is there anything you wanted
absolutely.
to say about
I think
that?
the other thing that I'd mention is it sounds like for whatever reason you kind of restarted now, and what can be really useful is to have a think through. One of the things that we look at from a behavioural perspective is what purpose does the cigarette serve? As in, what is it doing for you? So more often than not, sometimes it can be just simply because of the nicotine craving, but sometimes it can be because of a difficult emotion that we're experiencing. So it can be stress, it can be boredom. And so what can be really, really useful is to have a think through what emotion is it helping you to manage, and if you were to stop smoking, and you know you can do it because you've done it already, so you're already there, is having to think about what else could you do to help support that same emotion. So for example, if it's because you've been feeling a bit more stressed recently, have a think through what could your other outlets be for stress that you could do instead of having that cigarette. So that actually, rather than feeling that craving in your brain saying just have the cigarette, is thinking through, think underneath it. Why am I getting this craving for a cigarette? What is it there for? Is it just habit? Is it the nicotine? Or actually, is it because I've got a big emotion that's come up that I need to try to manage? And what can I do to get around this? What worked for me when I stopped smoking previously? You can do it. You've done it before. If you did want that support, absolutely you can get in touch with us, either with our team or with the Community Stop Smoking team.
And I'll put the links into the comments box. Even if the video stops, I'll put all the apps that Kate, the links to the apps that Kate was talking about, as well as obviously the services that you can tap into. Also, your community midwife can also expedite that referral if she hasn't already to the service. All right, to help you. Is there any other comments? Please keep coming. Please keep putting them through. I'm not seeing anything more. I've only got one comment so far, and that was from Roxana. But please, anything at all, even if it doesn't relate to CO screening. But if you've got any other burning questions, this is your opportunity to put them through. Okay. So Lottie's just put, hi there, non-smoking related. However, a partner's allowed into scans yet. Unfortunately, Lottie, there's no movement at the moment in relation to that. We are still, it's still the same visiting policy at the moment. We will be sure to share anything that changes in relation to visiting with MVP. Myself and Wendy have regular contacts with MVP, so we will definitely pass on any changes in relation to that. Laura's just put, hi, I've been told that if you are going to be induced, you need to isolate as a household for 7 days beforehand. Is this still the case? Laura, that's correct. So at the moment it is just to try and minimise that wider exposure. So we are asking that your birth partner as well as yourself is isolated for 7 days before induction. Again, if anything changes, we are starting to look at recovery plans, and if anything does change, we will be sure to share that information through MVP. Roxana's put, thanks so much, not a problem at all. As I said, I will put those apps and helplines into the comments as the video closes towards the end. Any other comments or questions? Anything, as I said, it doesn't have to be specific to CO screening.
Thank you all for tuning in.
Absolutely. I think it's a real really fantastic opportunity to, share different updates and real great opportunity.
Absolutely. And good luck with everybody who's pregnant and having your babies soon. Super exciting. Hope you're not suffering with the heat, as it's getting a little bit warmer.
Also, if there's anything that people feel that they would like to hear in subsequent Facebook Lives, please just put them again in the comments, because it really does help us internally, you know, just to try and filter the information that we are sharing. I know obviously a lot of the videos are being uploaded onto YouTube as well, so you can always look back on some of the videos that we already have undertaken. But if there is anything that you feel, oh, I'd really like to hear a little bit more in depth about that, then please again put it in the comments so that we can have a look at that. Certainly come August time, we're going to get the community teams, all the community teams are going to do like a Meet the Midwife event, Facebook Live, so that is also another opportunity just to hear and meet some of the midwives within your wider team. There's nothing coming through on there,
no,
is there?
We're all good. Excellent.
Oh, I live 10 minutes away, walking from the hospital. Can I take babies home in a pram and walk home, or do we need car and car seats? Roxana, it very much depends on the birth that you're having. So again, if it's a vaginal delivery, which, you know, we would be aiming for, it very much depends really. I think on, you know, if it is an operative procedure that is required, then I would be saying you need to be supported probably in a car as opposed to walking, because although we want to promote that mobility, I don't know how far away you live from the hospital, so it's just, you know, being aware of your own maternal well-being. Hang on, a couple more questions come through. Oh. Laura's put another question, sorry if you've already answered this. In terms of testing for COVID when you come and wearing a mask when you come in labour, could you just recap the current process? Yes, sure. So Laura, in relation to COVID testing at the moment, so it's for all women that are admitted. So if, for instance, you came into the maternity assessment unit for assessment for whatever reason but weren't admitted, you'd be discharged home. You wouldn't necessarily be tested then unless you were symptomatic, okay, in which case then I'm sure they would be doing their screening before you're coming into the hospital anyway. If you're admitted, so say for instance you're coming in for induction, you come in, you're admitted in early labour, again or you're in labour, then that's when they will screen you in relation to COVID. That is the current process. We are asking everybody, so when they're coming into the hospital, to wear a face covering, face mask, and in relation to that, we wouldn't expect you to continue to wear that face mask when you're in labour. Of course, once you come into that labouring room, you know, you would be able to take off your mask, but the midwives and the staff that are looking after you will be dressed in their personal protective equipment, so their face mask, their goggles and the gown. I hope that answers your query in relation to that. Rebecca's just said, I've recently had our baby and would be keen to take up the offer of meeting up with a doctor and midwife to discuss the birth and go through my notes. Birth was so good, it's not about complaints, it's just we still have some questions, and I know this is a service we can request. How do we go about arranging this? That's not a problem, Rebecca. So there is a service called the Birth Afterthoughts service. And again, I can share the details in relation to that after. Make sure that MVP put that up, or you can ask your community midwife. At the moment, those appointments are done virtually, but absolutely any questions around that, and if you don't get your questions answered, again, myself and Wendy also review cases as well. So I will put that up at the close. I hope that's okay. Any other questions or queries? We've got another 20 minutes or so, so please feel free to utilise us. Do you want to talk a little bit about what else you offer in Here for Health?
Oh my! Well, Kate? If you want to, yeah. Yeah, I mean, as I mentioned, within the Here for Health team, we are accessible to anybody, including anybody who's pregnant. So if there's somebody that feels that they'd like a little bit of one-to-one support to be as healthy and as well as they can be, so if you are finding that you want a bit of support around healthy eating or getting active, Those are generally the key things that we get sort of referrals for. Or yeah, if you did want some support, sort of one-to-one, you know, with stopping smoking or around what we call emotional fitness. So we know that emotional well-being isn't sort of black and white. It isn't that you're well or you're unwell. It's like physical fitness, you can be emotionally fit, and there's things that we can do as an individual to become emotionally well, or emotionally fit. So have you heard of the 5 ways to well-being?
Yes, I have.
Can you remember what they are?
It's testing you.
Absolutely. Now can I? That's the real question. But what we do is we support individuals to apply those 5 ways to well-being to their own lifestyle and what that looks like.
And can that be for partners and wider family?
Yeah, absolutely. So it's anybody at all that perhaps isn't so keen on group settings and would like to just have a discussion with somebody. So at the moment we're doing telephone support and video calls as well. So you can be in your own home and you would just click on a link. It's kind of similar to Zoom, and then you get one of our team kind of talking you through what we do. So the nice thing I think really is that we can cover lots of different topics. So we'll get somebody that will come in and say, you know, I'm interested in reducing my risk of diabetes through healthy eating, or reducing my risk of cholesterol or whatever. And from that discussion, we can then kind of broaden it out and go across lots of different topics from there. So yeah, it's good.
And if mums had partners or wider family that wanted to tap into that service, how would they go about that?
So we can write it in the comments. So the best option really is going to be to send us an email. So we are here for health. I'm going to show you this just at the bottom. Here for health at ouh.nhs.uk. That's us there. And you can check out our webpage as well there if you want to. Yeah, and see the team, see all of our mugshots on there. But yeah, the best option really is send us a quick email, and that will come through. We check our emails every day, apart from the weekends, sorry. And then we'll get in touch and kind of take it from there. There's no obligation, as I said. You know, it just, we work with you to help you to be as healthy and as well as you can. So it's always worth giving us a quick. Send us a quick email. You can give us a call as well if you want to. So 01865 221 429 and speak to a member of the team. As I said, we're part of the NHS. We're kind of a bit of a jack of all trades from a health and wellbeing perspective. And we support everybody. We've got no limits
on age or anything.
No, yeah, we've had people bring in their toddlers, and then we've had all the way up to, I had a 94-year-old lady who was amazing. She was very annoyed that she wasn't walking as quickly as she used to, and she wanted to get a fitter. So yeah, so it was really nice. So we see a little bit of everything.
Fantastic.
Yeah, within the centre.
Is there any other questions that are coming through? Anything at all?
Great. I think that's that's us.
That's great. Thanks for tuning in. As I said, if there's we'll hold on for a couple more minutes, but unless there's any other queries or questions or anything that you want us to bring to the next topics, then please just feel free to put them in the comments, and if we don't see them now, we'll certainly see them after.
Absolutely. And if any comments do come up that are carbon monoxide or smoking related,
absolutely,
feel free to let me know or forward them, and I'm happy to.
Will do, Kate. Thank you.
I can do.
Okay, thank you everyone.
Fantastic.